Broadcasting live from the Subaru of Gwinnett studio inside the Sonesta Gwinnett Place Atlanta Hotel. It's time for Gwinnett Business Radio. Gwinnett Business Radio is cared for by Eastside Medical Center, providing quality care to Gwinnett County and the greater Atlanta area for over 38 years.
And welcome to Gwinnett Business Radio, and we are not broadcasting from the Subaru of Gwinnett studio today. In fact, we are broadcasting from Eastside Medical Center, where we are joined by three of the doctors here on staff as it's Ladies' Night Out for Heart Health. And joining us now is Dr. Michael Lipset, Dr. Marcus Sims, and Dr. David Casey. They are cardiologists here at Eastside Medical Center. And Dr. Sims, you're also the cath lab director here
correct.
at the hospital. But you guys just had a discussion upstairs with an audience, and you three were talking about healthy living and focused really on women. What was today's conversation all about, Dr. Sims?
Cardiac health, and it was all about the Go Red campaign that started several years ago to reduce the amount of women having heart disease.
Dr. Lipset, how did it go today, and what was your message today?
It did great. Well, as you know, there's been a surge in the information that women are catching up to men when it comes to heart disease, and the symptoms of heart disease in women can be unrecognized as far as coronary disease, so that was stressed tonight, as well as risk factor prevention, modification, and heart-healthy lifestyle.
And Dr. Casey, your takeaway from tonight?
Yeah, my takeaway was that women really want to hear about their heart and the ways that they can reduce their risk of cardiovascular disease. And I think they were very appreciative for HCA, the Eastside Medical Center, to put this on for them so that we can get the word out and give them some insight in what they can do to reduce their risk and, pay better attention to their own individual health.
We know you have the latest technology here, the latest equipment here at Eastside Medical Center, but I find that education is really, really important for EMC. Talk about why is education so important when it comes to women's health and the women's hearts?
Yeah, so I would say it's very important, like I told the ladies up there, there's a big push on breast cancer awareness and health, and there's a big push, with the NFL as far as looking out for women and breast cancer. But I think with heart disease being the number one killer of women, there needs to be a big push for heart disease.
The data is that heart disease, death from coronary disease, has decreased steadily over the past 10 years in men, but not at all in women. And this is part of an effort to get the word out, to let women realize that it is the number one killer of women, certainly women over 65.
Why is that? Why is it down for men, not for women?
Well, we think part of it is not recognizing the symptoms of heart problems in women. And the other thing is that I call it you've come a long way, baby. You can have heart disease like men as women get into more stressful professions and their lifestyle is catching up to men.
Dr. Casey, what are some of the symptoms that women should be looking for?
We were talking earlier, simple things like hot flashes, like cold sweats. Some of those things can be mistaken as just those symptoms associated with menopause, but women sometimes don't realize that those can also be associated with something even more insidious or something even more serious as coronary disease, acid reflux, nausea, vomiting. Those are some ways that women can present atypically or different than men.
When you were talking to the audience earlier tonight, was there something that you shared with them that kind of surprised them, maybe a misnomer, something that people aren't aware of?
I guess they were surprised that, women don't have the same symptoms that men have. And they were probably alarmed at the amount of women that have heart disease. The number's pushing close to 500,000.
Wow.
10 years ago, it was probably 350,000. So that was some shocking things for them.
You talked earlier about the rate, not decreasing for women. Is that across all levels, all classes, all races?
That's a good question. They probably hadn't looked at it that way as far as race-based.
It's clearly increasing in younger women. That's another unrecognized form of heart disease. The numbers have increased in women in the 30 and 40-year-old age groups.
Any idea why that would be?
I think it's the same reason, lifestyle changes.
Well, let's talk about lifestyle changes, and we'll ask each of you, what is one of the reasons, what are some advice you might be able to give, or a lifestyle change that a woman can make out there to help with heart disease and cardiac?
Well, I think we're all agreed the first thing we recommend is not smoking or being around cigarette smoke, because that is the most preventable thing you can possibly do to dramatically reduce your risk of heart disease. And then the modifiable risk factors, diet, exercise. And I actually learned from the other two here that reducing stress is as important as any other risk factor.
Really? So the stress is just as important as whatever you eat and put in your mouth?
Absolutely.
Dr. Casey, anything you want to add as far as a lifestyle change or something that ladies should be looking out for?
No, I think he hit the nail on the head. It's going to be cardiovascular risk reduction from healthy eating, as well as reduction of blood pressure. That's going to be an important one. Making sure that you take your hypertensive medications. Also cholesterol, making sure that you look into and monitor and measure your cholesterol levels. If you need cholesterol medications, making sure they take it, and if they're offered one and their cholesterol is normal, then ask questions and get a straight answer into why that is. Because there's a lot of risk scores and new things that we do as cardiologists to assess risks that don't always correlate with an actual number on their lipid profile.
Dr. Sims, any other advice you might want to give as far as a lifestyle change or something that women should be looking out for?
Yeah, so I would say, the dynamics at the household have changed since you and I grew up, when the mom was at home and the dad was working. And so you have both the mom and dad now working, and there's a lot of fast food out there, and we don't make healthy choices. We're on the go all the time. We're in this social media world of things, and everything's go, go, go. So I think if you make healthy choices as far as your foods, that will help you try to integrate exercise, and I think that will go a long way.
How important is sleep?
Studies say you should get 8 to 10 hours of sleep. I don't think we get that in our world of cardiology, but ideally you should at least get 8 hours of sleep. Get you some REM sleep in there with some dreams maybe, and I think you'd do a lot better.
Dr. Lipset, talk about some of the cardiovascular services that are available here at Eastside Medical Center and what makes you a leader in that area.
Well, we've been fortunate to have a really good support staff in the cardiac cath lab where we do all the diagnostic procedures to diagnose heart disease. We have stress tests, nuclear stress tests, echocardiograms, Holter monitors, event recorders, and we do not do transplants here. And we do refer cardiac surgery from here, but all the other diagnostic tools are available.
You mentioned the testing. How often should people get tested? Is it something that should be routine every 5-10 years, perhaps?
Well, certainly in men who have the highest risk for heart attack, starting, I say, at age 40, you should have heart testing, and then depending on your risk factors, how many years thereafter you should be retested. Dr.
Casey, your thoughts on testing as well?
Yeah, it depends on risk factors. It also depends on symptoms. Definitely if you're having chest pain or if you're having shortness of breath, you should get tested. Even if you have a history of cardiovascular disease, you should definitely see a cardiologist and get tested.
This is a special Eastside Medical Center episode of Gwinnett Business Radio. We're joined by Dr. Michael Lipset, Dr. Marcus Sims, and Dr. David Casey, all cardiologists here at Eastside Medical Center. As we wrap up the interview, I'll ask each of you one big takeaway, one big message. If people can remember one thing, what would that be? I'll start with you, Dr. Sims. What do you believe should be the biggest takeaway from all of this?
I would just say that we had a fantastic event tonight, and if you could reach out to one of your friends and invite them next year so they can hear the message and we can get the word out about women's heart health, I think that would be the biggest takeaway for me.
Dr. Lipset?
I'd say one of the biggest takeaways is that the first presentation for coronary disease for a lot of people is sudden cardiac death. And so anything you can do to think of prevention is going to be beneficial, obviously. And even if you're asymptomatic, you should be tested for things like heart disease.
And Dr. Casey?
And to remember that they don't have to go far for their cardiovascular health. They can come right here to Snellville at Eastside Heart and Vascular. We have 5 locations in this county, and so wherever they live in this area, they can be seen within a reasonable time period.
You were trained well, very well. You gave the locations and mentioned there are multiple locations. You don't have to come right here to Eastside Medical Center in Snellville. There are several locations throughout the Gwinnett area. So thank you to all 3 of you for joining us here on the program. A quick reminder that for all this information, you can go to the Eastside Medical Center website, which is?
They can go to eastsideheart.com or just Google Eastside Heart and Vascular, and it should pop up.
Great.
And they can find us.
Great. Quick reminder, you can listen to this program anytime by going to Business RadioX, selecting the Gwinnett Studio, and then clicking on Gwinnett Business Radio. And also don't forget to follow us all over social media at Gwinnett RadioX. Until next time, Mike Salmon with you here on Gwinnett Business Radio on Business Radio X.